Chapter 13, Community and Social Justice Perspectives. As professional counselors, we have an ethical duty to promote social justice and be agents of change and advocates in the community. So it's really important to figure out first who is included in that aspect of community. So we might hear reference to things like community mental health centers or community counselors. In fact, prior to the 2016 CACREP standards, under the 2009 CACREP standards, clinical mental health was actually called community counseling. The clinical mental health label is something that's a newer concept. So it was this idea that counselors are there to serve the entirety of the community. And so that community includes public or private as a community agency. So if you're working for like community mental health centers, those are institutions providing a wide range of different types of services to all members who live within the community. And you as a community worker, for example, as a counselor, is a person who serves all individuals within a community. So we can't discriminate against certain community members. We are really there to serve everyone and provide as much support as we can while we're still honoring our scope of practice, of course, in their areas of competency as professionals. And so community workers are not just counselors, but counselors, social workers, members of the clergy, community organizers, and other support systems that might be in place. And so as community supports, it's really important to think not just about our own work in isolation, but how our work as counselors connects with others in the community who are also providing supports. So ideally, we can work towards creating a system of support or a network of support to make sure that all community members are served and no one is getting left out or overlooked. So as counselors who work within community programs, it's important to not just focus on our work that happens in our individual counseling offices, but in all of the different facets of the services that we provide. So these include direct community services, which are, as counselors, things that might involve going out into the community and providing education or support for the community at large and not for one in particular community member. This can also involve being out and being visible in community spaces so that folks in the community know who to reach out to when they need support or when they're in a crisis, because they've already met you and they've seen you as part of the community. There are indirect community services, which is that advocacy piece. So as counselors, we have specific knowledge about different mental health issues or different school issues that might be going on. We have knowledge about specific things in communities that might be going on because we see and hear about them in our work with individuals or schools or families that we're working with. But we also have power. You as professionals have power and influence. Your voices are heard oftentimes more than the average community member, particularly with stakeholders or decision makers, because you have education, you have formal licensing, you have all of these things that lend you privilege and power to be heard on a broader scale than the average community member might be. And so we have an obligation to provide those indirect community services, which means using our voices as advocates to influence policymakers, to influence stakeholders, to make sure that they understand what the problems and needs of the communities are, so that hopefully we can influence change that provides more supports, more resources, more ability for community members to be healthy and to thrive. We provide direct client services, which are the things we talk about all the time. So that counseling that we're providing in our offices, that's meant to empower individuals and uses our skills, knowledge, and understanding to do so, but also doing so in a way that honors cultural identity and acknowledges the power differential between us and our clients that we serve. And then there's indirect client services. So again, working as an advocate in the community to address factors or barriers that are impacting our clients as a whole. So, for example, if I work with, as a counselor, a lot of low-income clients, and they're really struggling to be able to get to appointments because they don't have consistent transportation. I might, as a counselor, knowing that this is something that's impacting and creating barriers for my clients to be able to have jobs or be able to get services, I might go to my city council and I might talk about how important it is to maybe change the route of our public bus system to make sure that it includes our community mental health center as part of the route, or to make sure that they understand that transportation is a big issue for people to access healthcare in our community, because not everyone may be aware of those problems. And I can do that without violating confidentiality. I can do that without revealing client information or identifying my clients. I can just say, I work for this agency, I see this a lot, and from my perspective, it's a barrier for our community members to be able to access healthcare. And that's a great way for me as a counselor to provide indirect client services as an advocate. So the ACA Code of Ethics says that all counselors work towards social justice. So it's important to take a moment and just define what these things are. So social justice in general is this dedication to the idea of access and equity for all members of the community to be able to fully participate in life as a member of society. So having equal opportunities and access for things like education or healthcare or advancement in meaningful career opportunities. It's just this idea that we should address any and all barriers that are getting in the way of all community members being able to have those opportunities. And so thinking about things from a social justice perspective really means that we're working from an assumption that all people have a right to equal treatment and fair allocation of resources, including having their voices listened to and heard in decision-making process, because not all voices are heard in the rooms where decisions get made. And it's so important for us to make sure that we're capturing the voices and experiences of all community members, and particularly the community members that really need access to resources the most. So our ACA Code of Ethics refers to the role of social justice advocacy as an ethical mandate for counselors. This is not an optional thing for us. We need to use our voices and our power and influence as professionals in the community to really not just help our clients as individuals, to help the overall health of our communities by being agents of change and advocates. So this is part of the deal. This is part of our role and our professional responsibility, is to always work towards social justice initiatives as part of our community service. So the goal of counseling is to promote empowerment of our individuals or identified clients, but especially those who are marginalized and oppressed within our community and society systems. And that is always the case. There's always someone who does not have the same opportunities or the same access to resources that others do. It's just a fact. And so it may not be something that we always see, because we may not experience that marginalization or oppression, but it doesn't mean that it doesn't exist just because we haven't seen it or experienced it ourselves. So when we are hearing about our clients struggling with these things, we have to really honor their experiences, and we can't really question if the things that they are experiencing are real just because we haven't experienced them ourselves. So it's important to translate the social justice perspective into your counseling practice, because we always have to have an ear and an eye out for different barriers in the communities that may be representing things that are challenging the progress of our clients towards their goals. So just wanting to reiterate this idea that we all exist within a system. So we don't exist in isolation. If you think about it, everything and everyone is connected in some sort of way. Some ways very directly, some ways not so directly. And you'll go over the systems theory a whole lot more throughout the program. So we're just going to hit the high points for right now. But the idea is that within this ecological theory, it says we all live in a system. Every single one of us. No one is exempt. And so there are parts of the system that are closer to us, things like our families, our schools, our communities where we work, where we might practice our spiritual beliefs or religious communities we belong to. Like, all of those are our context. Those are the system that we operate in every single day. And those in the microsystem within this theory are places where our voices get heard pretty often. Typically, you're able to have a lot of influence from these systems, again, both positive and negative, but also places where you're usually able to use your voice to some degree and have it heard. Now, there are connections between those places that may not directly involve you. So thinking about how maybe your family members interact with other people at your school, but those interactions may not directly include you, or if your coworkers have connections that don't involve you, or your neighbors or your community members have connections and interactions that don't involve you. Sometimes those interactions can still influence you even though you're not directly a part of them. So it's this idea that I'm not just influenced by the things that are directly around me every day, but I as an individual am influenced by other things that are going on around me, even if I don't know that they're happening. That's sort of talking about the mesosystem, is this interaction between different things that may not include me directly. Then as we work into the exosystem, these are things like economics, laws and politics, the broader education system, so not just my individual school, but like maybe things the school board develops or the Department of Education on the federal level, systems of government. Those are things that influence me quite a bit as an individual because there are different laws that are put into place that influence my life, decisions that are made on a broader level around education that influence my life. Economics certainly influence all of our lives. I think we're going through a moment right now where we can really feel and appreciate on an exosystem level how much economics are impacting all of us directly. But think about how much opportunity you have to include your voice in some of those things that are happening. Like every once in a while, I have an opportunity to be an advocate and to have my voice heard in a political system, either locally or federally. And as a counselor, I've been able to do that. I've been able to be involved with advocacy efforts on the federal level and on the state level. But a lot of those conversations happen without me, even though they influence my practice and my work and my life and my taxes and my home and my family. And so recognizing that the further we get from the center of the systems theory, the less influence and less power the individual has on that system. But all systems have a lot of power and influence over the individual, no matter what. Then branching out further in the macro and chrono system are just sort of like overall beliefs and values that influence your life, but you don't always have a lot of ability to change. You can interpret them differently and live differently according to those values, but you're not likely to be able to change the entire value system for everyone. And then that these things change over time. So different phases of your life, different phases of society, these things change. They're not static concepts. And so all of this in terms of social justice perspectives are that there can be different things going on in these different levels that are influencing the individual or creating barriers for them to be able to realize their goals or be able to get their needs met. And so we as advocates need to be aware of this, first of all, but then identify potential areas where those barriers are being created and try to address those as advocates. Because again, as a trained professional, as a person with power, my voice can permeate more levels of this system than the average community member. So my clients who have Medicare, and I as a professional counselor am not able to bill Medicare. Professional counselors cannot bill Medicare on a federal level anywhere in any state in the United States. If I have a client who has Medicare, that individual client is not likely to be able to go to Washington, D.C. and sit down with congressional leaders and say, hey, I'm not able to see the counselor that's really the better fit for me because my insurance won't pay for them. But I, as a counselor and as a member of the American Counseling Association, have gotten to do that. I have gotten to go and tell stories of my clients and be able to share about how this is impacting our rural communities because I have power and privilege for my voice to permeate more levels of this systems theory than the average community member. So just marinate on that a little bit. Think about how you might want to use your voice as an agent of change to pursue social justice as a professional, because believe it or not, you're rapidly approaching a status in our communities as professionals where you're going to have the opportunities to do that. And so I invite you to take a little time and reflect on how that might look for you to engage in some of these conversations on these different levels. So the American Counseling Association provides us some guidance in this area of advocacy. So they provide these advocacy competencies that help guide practitioners in being able to serve and act as advocates on different levels of communities. So that's the individual level, the broader community or school level, and then the public level. So we'll take a moment and just look a little bit at this model just to talk about what it looks like for counselors. So looking at this advocacy competency model, you'll see a couple of different things. So on the left-hand side, it delineates the difference between two different forms of advocacy. As a counselor, there might be instances where I'm acting with my clients and they're involved in this advocacy effort. And then there might be different instances where I'm acting on behalf of my clients, but they're not actively involved or with me when I'm acting as an advocate. So there's a delineation of those two different areas. And then down at the bottom, you'll see something that references that Bronfenbrenner systems model that we were just talking about. So things that are happening on the micro level in the systems that you interact with every day, and then working more towards the macro level, which is where we might be addressing some of those circles where our individual community members' voices would not typically be heard, but we can use our power as professionals to be able to amplify their voices in those circles. So working our way from left to right, you'll see first the area of individual influence, so the client-student empowerment advocacy competency. So acting with might look like providing clients or students with certain types of empowerment. This might be helping them learn how to advocate for themselves. This might be acting with a student, so sitting down with a student and a teacher. If the student's maybe a little intimidated about the teacher and having some problems, maybe you sit down with both of them and help work through things. Or you're a member of an IEP team and you get to include the student in that process to talk about the best options for them in the school. So there are different ways that we would act with the client. Or we might act on behalf of the client, so advocating on behalf of that student with a principal or a teacher without them being in the room, or maybe advocating for things that are influencing your clients in your agency or in your city council perhaps. Then moving into the broader school or community. So acting with might be opportunities for community collaboration. So you might either assemble a group of community members to maybe solicit some feedback, or you might get involved with different advocacy and support groups in the community to make sure there's a therapeutic voice involved in that process, but you're also understanding the needs of the community so it can influence your work. You might also act on behalf of the community. So you might go and use your voice in different systems that are more broad to talk about barriers that you're experiencing. So that example of noticing the transportation issue and going to my local city council and testifying about how my clients are not able to get to the community mental health center because it's not on the public bus route. That might be something on the systems level, on the school community level, in that middle piece. I might act on behalf of my clients in that way because I wouldn't bring my clients with me, but I might go talk about it as a whole. Then on the right, we have the public area. So acting with my clients might be either collecting or sharing public information. This might include putting together reports or working with community members to help with grassroots efforts to make changes on a broader public stage. And then acting on behalf of our clients, this might involve like meeting with legislators or writing letters or helping influence legislation that's going to help alleviate some of those barriers to our clients. So going to talk to legislators about why counselors should be able to bill Medicare, or why certain healthcare regulations are important, or licensing is important, those sorts of things. So again, I just want to challenge you to think about what this might look like for each one of you. So I challenge you now, but also throughout your work in this program as you get into practicum and internship, think of a group of community members that may be experiencing oppression, that may be broadly underserved. They may lack ability to use their voices on a broader scale because they're not heard or people aren't listening to them. So challenge yourself to start seeing parts of the community that are not well served. Start seeing parts of the community that are not well heard or listened to. Start to recognize and notice those things. And then challenge yourself to think about how you could act as an advocate using that ACA advocacy competency, considering those different systemic levels in the systems theory, thinking about how you could get involved as a counselor to make a difference in the individual level, on the school or community level, and then in the public area, and maybe brainstorm some different ideas of things that you could do or ways that you could get involved, so that when you do graduate from the program as a professional counselor, you already have sort of brainstormed ideas that you could incorporate the social justice perspective into the work that you do in the community. So what might this look like? So in terms of community work, you might consider outreach interventions. So going into the community to provide education about certain mental health issues, or particularly in Wyoming, just showing up in different spaces and having a therapeutic presence in spaces. In Wyoming especially, we experience so much stigma around seeking help and around talking about your problems. And there's so many communities that don't feel like they have a lot of options because they're fearful of being judged or ostracized or victimized when they seek help. So it's so important as part of outreach interventions to go out and provide psychoeducation for community members, but also to just show up, to just be a part of community events or be a part of support groups that already exist in the community, so that there are counselors that are visible in these spaces, and you're really showing that you care and that you're dedicated to social justice and that you're there to help, so that when they need those therapeutic supports, they know where to seek them out. For school counselors, this social justice and advocacy perspective, it's critical. So thinking about how culture is honored or maybe oppressed within your school setting. Do all students have the opportunity to express their cultural identity in the same sort of way? And how can you build better relationships between your school and the community through comprehensive school counseling programs? So we see things like wraparound programs or the Community Schools Initiative that really help provide a lot of guidance for school counselors to build stronger connections between schools and the communities that they serve, because students often don't live by themselves, which is kind of a silly thing to say. But if you think about it, students are supported by their families and by their communities and neighborhoods. And so how can we expect students to be able to come to school and engage in school and be healthy if their families and communities and neighbors and are not healthy? So we have to make sure that we're serving everyone and building good connections. And then there's also a developmental approach to these things. So always coming from a strengths perspective and positive perspective, wanting to highlight things that are working well before we highlight things that need some work, and being really collaborative. So I cannot go into a space, particularly a space where it's not my community, it's not my cultural identity. I can't go into these spaces and assume that I know the best thing to do or the way to fix problems, because I don't. If it were that simple, the community would have solved the problem a long time ago. I'm not some magical unicorn creature that can come in and solve everyone's problems when they weren't able to solve them already on their own. So I have to be collaborative and really take the time to understand the perspectives of the community members I want to serve. And as a professional, my focus is often on prevention. So how can we make sure that resources are available? How can we address stigma that's keeping people from being able to access those resources? And how can we address things on a broader systems level to make sure that those resources continue to be available? So it's a little bit of a different perspective, because I'm not focused on diagnosis. I'm not focused on problem solving. I'm really focused on this idea of prevention and thinking about ways to be proactive in making sure resources are available before things get to a point of a crisis. So as I'm enacting all of these things as a counselor, I might try on and wear some different roles that are a bit different than my typical roles. So we've talked a lot about being a change agent, which is helping clients or communities recognize oppressive forces in the communities that they contribute, as they contribute to the issues that they're having. So sort of just validating that, like, it's not just you. I mean, this whole system's sort of stacked against you, and that's got to be really frustrating and difficult for you. But always wanting to be really careful to not oversimplify an issue. So highlighting oppressive forces that exist in someone's life, they may already be very aware of those things. And I can't oversimplify the impact that that has on my client's life or how they were developed in the first place. And I can't presume to know or understand them, especially if I've never experienced those things. So I have to really be an agent of change, but use my good empathy skills to really consider things from the client's perspective and to focus on these things as much as they're actually useful for the client. As a consultant, we talked about the consultant's role. So I might, as a consultant, help organize community resources based on client feedback to help minimize the harm that they're creating in these systems and to maximize the availability and access to these resources as much as possible. Being an advocate, we've talked a lot about this already. I might be a facilitator of Indigenous support systems. Again, I'm not going to go and pretend like I'm an expert in any kind of cultural or tribal healing systems because I'm not. And it's not appropriate for me to pretend like I am. But I can help raise awareness about them, or I can make sure that I'm advocating for opportunities to include those things in the services that I'm providing. So encouraging honoring of cultural factors, supporting cultural identity, and including cultural identity in the healing system for clients. In Wyoming in particular, we see like inpatient rehabilitation centers, like substance use treatment centers, starting to incorporate more and more Indigenous healing practices into the work that they do, so that if tribal community members are seeking out substance use treatment in an inpatient setting, they still have opportunities to include their own healing practices and their own like rituals and things in the process, which is really important, right? Because we can't sever our cultural identities to heal. We need to embrace our cultural identities as part of the healing process. And so we want to make sure that we are being able to be advocates for inclusion of those things in support services that we're offering. And we have to be willing to learn about them and collaborate with different resources to be able to provide those kinds of things for our clients so that we can help them heal in a way that's more wellness and holistically focused.